Hello everyone, this is Muhammad Ahmed and welcome to our channel Pharmacy Enlightenment. In the very first video of our channel, we are going to discuss pharmacy, pharmacists, roles of pharmacists, and the scope of pharmacy. So let's begin. So what is pharmacy? The word is derived from an ancient Greek word pharmakon, meaning medicine or a drug. Nowadays, the profession pharmacy is defined as the science and art of preparing, dispensing, and proper utilization of medicinal drugs. Science means knowledge, and art means skill. Not all educated people can prepare a medicine. Skills are required, without which you would never be able to prepare a good medicine. And the third point is it includes provision of drug related information to public. As a pharmacist, it is our duty to provide each and every drug related information, such as reactions, properties, time of taking that particular medicine, side effects, storage conditions, and way to use. All this is the part of this profession. So, this profession is all about drugs. So, coming to the next point, that who is a pharmacist? A pharmacist is a professional person, properly trained and skilled, knows every stuff related to medicines, their properties and use, their uh, methods of preparation, the science behind their preparation, and the way of handling it to the patient. Well, in few countries in the world, there is an illegal practice of dealing medicinal drugs without the license. So, remember, for the license, you need to be qualified from an authorized institution. You must be a degree holder, I mean. Moving towards the subjects of pharmacist studies in pharmacy, physiology, anatomy, biochemistry, and pathology. These four subjects make us better understand the normal and abnormal functioning and chemistry of the human body. Pharmacology. It refers to the relationship between drug and the body, how a drug acts, and how the body responds. Pharmacognosy gives us knowledge about natural origins of drugs. It may be plants, animals, or any other natural origin. As we get the drugs from the natural origin, we try to synthesize these drugs artificially. For this, organic and medicinal chemistry helps us. And to identify a drug or check its quality, we study analytical chemistry or pharm analysis where we use several techniques. Now, pharmaceutics, it is the dosage form science. A drug must be converted into a medicine or a dosage form to be administered. It may be tablets, syrups, injections, etc. Production of required dosage form and quality assurance is done in the industry, and this subject is necessary for this. Now, microbiology, as the production of several drugs require fermentation, sterilization, and the production of vaccines, all of these processes have some role of microbes. So, a pharmacist must be a microbiologist too. Then, clinical pharmacy. In clinical pharmacy, clinical tests and evaluations and patient dealing is taught. Then, biostatistics helps us in research work. Mathematics has a great role in this profession as it has a great role in every profession. Then, business management and law to be studied to know the business and legal parameters of medicinal drugs. After having a glance on all these subjects, we are able to understand the roles of a pharmacist better, to check the quality of the drugs and medicines, then checking the legality of drug supply, A pharmacist knows the abnormal functioning of human body. He must respond to the patient's symptoms. A pharmacist can prescribe suitable medicines to a patient. A pharmacist provides every drug related information to the patient, how to take it, at which time, etc. In industry, he supervises the production and quality control areas. He also provides information about new drugs to other health professionals. This is very important. And a pharmacist also gives services to patients such as blood pressure and sugar tests, etc. Now we will be discussing the scope of pharmacy. Where do pharmacists work? You must have seen a medical store or a pharmacy nearby you. That is a community pharmacy. As a community pharmacist, our job is all about helping patients and the public, assessing and responding to their conditions, and making decisions about which medicines they should take. We dispense medicines and offer patients pieces of advice and practical help on keeping healthy. Hospital pharmacist has the job to run a medical store in a hospital where supply of medicines and their quality is checked. They deal with the provision of medicines to OTs and OPDs. Then the clinical pharmacist. Clinical pharmacists have direct interaction with the patients as well as the physicians and surgeons. They also do lab work efficiently where they evaluate clinical tests. Then the industrial pharmacist. An industrial pharmacist supervises manufacturing process of medicines and check their quality, sterilize them and pack them. Then the medical representative. A medical representative works to represent a new drug or a medicine to healthcare professionals so that they can prescribe it to their patients. Medical rep works as salespersons too. Then the scope lies in research field. New drugs and treatments of several diseases are discovered each and every day, and this is due to the courtesy of pharmacists in research field. So some of the pharmacists uh, work as lecturers and professors in different universities all over the world, and and you know all these pharmacists are earning thousands of dollars. So there is a high scope of this pharmacy profession. I sum up this video by saying that many people argue that physicians are superior, others say pharmacists are superior. Physicians and pharmacists differ in their abilities, no doubt, but they can't work separately. Health system needs both of them. They should work hand in hand rather than discriminate themselves and call the other profession inferior. They should respect each other. This is all for today. Thank you so much. Don't forget to like and share this video as much as possible and kindly subscribe too.